how frequently do we forget to keep in our minds what is not right in front of us? What I mean by this is everyone is fighting their own battles. We should be considerate of them all, but are we? People deal with daily struggles such as depression and other insecurities, financial stability, and some invisible diseases. Today I'm going to speak of an invisible disease called lupus. According to the College of Rheumatology, lupus is a chronic autoimmune complex disease that occurs when the body's immune system attacks its own healthy tissues and organs. In today's speech, I'm going to address various issues to inform you about lupus. However, my 4 main points will be the different types of lupus and the sickening symptoms that follow, a few probable causes, treatment, and how a diagnosed individual's life is affected by the disease. Mayo Clinic states that lupus is often referred to as a complex disease because its symptoms often mimic those of other ailments, so it's difficult to diagnose. However, once it is determined that the patient has lupus, it's divided amongst 5 general sections that I have obtained by MD Chris Eilies. The first category is cutaneous lupus. This solely affects the skin, and the symptoms include a red, scaly, thick rash on the face, hands, and neck. Once the rash disappears, it could leave scarring and potentially hair loss in the scalp area. Next is the most common type of lupus, which is referred to as systematic lupus or SLE. It unfortunately can affect almost any part of the body and often comes and goes, ranging from mild to most severe. Common symptoms include a butterfly rash as I have pictured, painful joints, fevers, hair loss, swelling of the legs, and extreme tiredness. Now the third type of lupus is very rare but is referred to as drug-induced lupus. This occurs when a medication is taken for a long period of time. Symptoms are similar to that of SLE, such as painful joints, fever, and rashes. The fourth type of lupus is neonatal lupus, which is again very rare and occurs when a mother with certain kinds of lupus antibodies transfers them to her child at the time of birth. What is concerning about this form of lupus is that the mother does not actually have to have lupus to transfer these antibodies. In fact, according to Everyday Help, only about 40% of mothers of babies with neonatal lupus actually have lupus. Symptoms in the child can include a rash like I have pictured, anemia, and even heart problems. Lastly, the fifth type of lupus is childhood lupus and is likely to affect the kidneys. Although lupus has been distinguished into 5 types, its cause is still unknown. According to the Lupus Foundation of America, many scientists believe that lupus develops in response to a combination of 3 things: hormones, genetics, and environment. Hormones are the body's messenger and they regulate our body's function. Without hormones, the body would be unstable and unfunctionable. Because 9 of every 10 occurrences of lupus occur in women, researchers have observed the relationship between the hormone estrogen and lupus. Observations have shown that many women endure more lupus symptoms before menstrual periods or during pregnancy, when estrogen production is high, obviously. So scientists have related that estrogen somehow regulates the severity of lupus. In other words, the higher the estrogen levels, the more severe the lupus. However, no causal effect has actually been proven between the two. The second factor to believe to be involved is genetics. No gene or specific gene has been proven to cause lupus, however certain families do have greater risk. And specific ethnic groups like people of African, Latino, and Native American have a greater risk of developing lupus. The last factor is believed to be involved is environmental agents such as a virus that could enable the lupus. Although researchers have not yet pinpointed a specific environmental agent that causes the disease, they have identified a few environmental elements that can trigger lupus and cause flares. The most commonly noted are UV light, emotional stress, and infection. As you can see, there is an excessive list of analyzed causes to lupus, but no distinct answers. This may or may not affect why no researcher has yet to cure the disease either. However, with all these uncertainties, lupus diagnoses are provided the only certain thing physicians can give them at this time, which is treatments to help lessen their lupus symptoms. Provided by Alliance for Lupus Research, steroids and anti-inflammatory medications are a common treatment method that reduce inflammation and pain. Several other drugs used to tame the disease, starting with uramin, that block inflammation pathways in lupus. Next, anticoagulants. Because blood clotting is a common symptom of lupus, this drug thins the blood to prevent clotting easily. Aside from medications, physical and emotional rest with a healthy diet is also promoted as well. Although it is great doctors have found ways to help patients cope with their disease, the side effects of taking these medicines can feel like a developed disease in itself at times. Some side effects include nausea, mouth sores, muscle weakness, hair loss, and other many side effects. A story issued by About.com tells a story of a woman named Alicia who develops lupus. She tells of her compelling personal experiences and states that she pursued all treatment available to her, including several of the medications I just told you about. However, eventually she developed so many side effects that she had to induce her medications to combat with these side effects. Now her list of medications totals an unbelievable 28 per day. She describes lupus as a devastating disease that affects all parts of her life. Medications are expensive. They could place a financial strain on a person's daily life. The regular doctor visits can become an interference, and lupus and many medication side effects transform the individual's bodies with bruising, swelling, and soreness as physical effects, but emotional effects from the changes as well. Alicia was right. Lupus really does affect all parts of her life. Lupus truly is a complex disease, so I'd like to quickly recap the facts about lupus that we have talked about today. First, lupus is 5 general types with symptoms ranging from butterfly rashes on the face to thick scaly rashes commonly from the neck up. Secondly, the cause of this disease is unclear, but it is believed to be involved with hormones, genetics, and the environment. Thirdly, common form of treatment include many medications such as anti-inflammatory and steroids. Lastly, lupus is an autoimmune disease that doesn't just affect a person's health, but their overall life as well. To research the disease and understand the lifelong battle these people go through, I have become hopeful for intensive research to lead to a better lupus prevention, treatment, and hopefully a cure. I have become considerate of the unknown life the others live. I can only hope that after performing this speech, you have developed new knowledge and consideration for the unknown battles and invisible battles people around you every day go through. Thank you.